Welcome, everyone, and thank you for taking the time to join us tonight. I'm Kelly Coleman, and joining me tonight is Beth Chester. We've been with the Medical School for International Health combined for about 15 years now. We're going to start by discussing a little background information on the school, go over the curriculum and things like that, and then we'll get into specifics about admissions. If anybody has any questions, you can ask them in the chat box at any time, and at the end of the presentation, we'll have a Q&A as well. So once again, thank you for joining us. We appreciate it. So MSIH was founded over 20 years ago as a collaboration between Columbia University in New York and Ben Gurion University in Israel. There's still a relationship between the two schools. It was founded really as a school to focus on global health. Can I start over? I don't like what I said. I'm sorry. This could be long, Beth. This could be long. Okay, I'm sorry. I'll start again. Okay. Pause. Welcome, and thank you for taking the time to join us tonight. I am Kelly Coleman, and joining me tonight is Beth Chester. We're both with the Medical School for International Health. Combined, we've been with MSIH for about 15 years now. MSIH is in over its 20th year now of graduating physicians. This will be our 20th graduating class actually this year. So we're very excited about that, really as a leader in terms of global medical education. What we're going to do tonight is start with a basic overview of the school, the curriculum. We'll talk a little bit about residency, some of our alumni and what they're doing. Then we'll get into admissions, answer any questions that you may have there, and open up for a Q&A at the end. If you have any questions, you can type them in the chat box at any time, or you can save them for the end when I will stop sharing my screen and we will just go over the questions. So once again, thank you for taking the time. We appreciate it. Just a little bit of background on MSIH. As I said, this year we'll be graduating our 20th class at MSIH. MSIH was founded over 20 years ago to be a medical school that not only educated doctors on the science behind medicine, but also on all the other factors that impact the health of individuals and populations, whether that's cultural, economic, political, environmental, all the different factors that impact people's health. Both Ben Gurion University, which is where MSIH is located, and Columbia University, which MSIH at the time was founded as a collaboration between Ben Gurion and Columbia. Both schools already had their own medical school, but MSIH was really founded as an innovative medical school. The world was changing. Physicians were encountering much more diverse patient populations than they ever had before. People were migrating. Diseases were traveling faster than ever before. And I really think over the past 2 years, we've seen the impact of that. And so MSIH was really founded to educate a new generation of doctors who understood health within their own communities, but also within diverse communities, understood cultural competency in medicine, and really had a solid foundation on global health that they could carry through in their training and also as they practice, no matter where they practice around the world. So classes at MSIH are small. We are part of Ben Gurion University, which we're going to talk about in a little bit. So you get the atmosphere of a small medical school that's part of a big university. And as I said before, MSIH doctors are really being trained to practice wherever they want in the world, whether that's in local communities, whether that's internationally, but really be very competent in terms of treating patients, no matter where those patients may come from. This is kind of a summary of some of the things I've already said, but really why study global health? MSIH provides comprehensive medical training. As I said, our students learn the science behind medicine. It's an MD program, so they're learning all those basic sciences and body systems, but they're also learning to work effectively with underserved and sufficiently served populations. They're learning to treat patients who may not speak the same language as you. They're learning to take into account socioeconomic determinants of health. They're learning all those other factors. So they're studying medicine and they're studying the sciences, but they're also studying epidemiology and ethics and perhaps sociology and anthropology. So they're really getting a very comprehensive medical training with a diverse view of medicine around the world. So some more specifics about the curriculum. I'm going to talk about the first and second year, which are predominantly classroom-based. MSIH is an English language track, as I said, at Ben Gurion University in Israel. So all the classes are in English. We do teach Hebrew, and the Hebrew classes are leveled. So if students come in speaking Hebrew fluently, that is great. Their Hebrew instruction will focus more on medical terminology in Hebrew, whereas some other students come in not speaking Hebrew at all, and their Hebrew instruction will focus more on conversational Hebrew, so that they're able at one point to interact with patients and have a conversation, maybe do a patient interview in Hebrew. So that's really the focus of the Hebrew instruction. The first 3 years of study at MSIH take place in Beersheba, Israel. Year 1 and year 2 consist of the basic science courses and body systems. In the first year, you'll be taking classes like microbiology, similar classes you might have taken as an undergrad, but at a higher level now. In the second year, you're going to integrate all those science courses into the body system. So you'll be studying the cardiovascular system or the neurological system. And I often hear students say that in the second year, they see things connect. They understand why they learned those basic science courses and how that helps them better understand the body systems. So really, those are the first 2 years. They're predominantly classroom-based, although there is some clinical work in the first and second year. And as I said before, we're going to talk about this throughout the presentation, touch upon it. Where we're located in Israel and Beersheba has a very diverse patient population. So in those first 2 years, you're learning to interact with patients, perhaps take a patient history, but you're doing so with patients who may not speak the same language as you. As much as Hebrew is spoken in Beersheba, so is Russian or Arabic. So students really get that diversity in their training. They learn to take into account what may be appropriate to ask one patient may be offensive to somebody from a different background. So in those first 2 years, the clinical exposure is it provides a very diverse clinical exposure and really cross-cultural competency training in that aspect. By the end of year 2, students are prepared to take the USMLE Step 1. They can take that in Israel, they can take that in the US, it's really up to them, but we do prepare students thoroughly for the USMLE, both through the coursework, the exams given in the courses, mandatory USMLE test prep, and different things like that. Step 2 will be taken in the 4th year, basically the same timeline as you'd be taking the USMLEs if you were going to school in the US. One other thing to note in the curriculum in the first 2 years, we do integrate global health curriculum as well. So in the first year, students are taking an introduction to global health course, which is taught by medical anthropologists. So it's a really interesting course. And in the first 2 years, students also get to take global health modules, which are really the equivalent of electives. So for 4 different times throughout that first 2 years, so 2 in the first year and 2 in the second year, students can select based on what courses are offered a global health module. It could be a course like sociology in medicine, mindfulness in medicine, refugee health, humanitarian disaster relief, human nutrition, a whole bunch of different courses, and students get to pick based on what they're interested in, what they think suits them best. And that's all just combined on top of the basic science courses and body systems that the students are studying in those first 2 years. Just a caveat here, if you are Israeli, you do, in order to be eligible to apply to MSIH, you must have completed either high school or undergraduate studies outside of Israel, as well as hold dual citizenship. So that's one of the requirements if you are an Israeli citizen to apply to the program. The program is really meant to be a program for international students all over the world. So if you're living in Israel, that's great. You just have to have completed high school or college outside and hold a dual citizenship. I'm going to turn it over to Beth, who's going to talk about the 3rd and 4th year at MSIH.
Thank you, Kelly. Good evening, everybody. Thank you for joining us tonight. 3rd year rotations at MSIH take place primarily at 3 hospitals in the southern part of the country, in the Negev. These include Soroka University Medical Center, which is located right on our campus. Also, Assuta Ashdod Medical Center, which is in Ashdod, and Barzilai Medical Center, which is located in Ashkelon. These are 3 of the top hospitals, not just in Israel, but in some ways around the world. Assuta is approximately 3 to 4 years old. It's probably maybe even now, maybe 4 to 5 years old, but it's a hospital with a little bit over 300 beds. It's a 325 bed hospital. It has already set itself out above the others with a world-renowned state-of-the-art emergency room. Now, Soroka University Hospital, which is where the bulk of the third year clinical work is completed, is right across the street from our campus, and it serves the entire southern portion of the country, making it the largest employer in the Negev, not just the largest hospital. It's a very busy hospital where you will see people from all different backgrounds, and you will see all different types of medicine at this hospital. Here too, the emergency room, similar to Asuta, is state-of-the-art, as is the neonatal and maternity wards, where there are over 14,000 births seen in 1 year. Some of our students have seen over 20 births just in one evening at Soroka. And the patients at Soroka will reflect the diversity of the local population, which will help you learn cultural competency as you are doing your clinical rotations. That brings me into another portion of our third year. In our third year, we continue our global health coursework with cross-cultural workshops. These clinical clerkships provide exposure to diverse patients from southern Israel's Bedouin and Ethiopian communities, as well as immigrants from the former Soviet Union, Africa, the Americas, and the Middle East. This prepares students to treat patients wherever they will eventually practice, urban, rural, sufficiently served, or underserved areas. When students rise to their fourth year, this is often the highlight of their medical education. The majority of our fourth year students return to the United States where they complete their electives. Our two elective coordinators, one based in the US and one based in Israel, work closely together and with the students to support the students and assist in their elective placements. Some of the locations where our students complete these electives include Columbia University Medical Center, with whom we have a very close relationship, as well as other institutions such as Hofstra University, University of Tennessee, and other institutions around the country with whom we have relationships. Students who plan on staying in Israel to complete their residency may complete their electives in Israel, and we encourage them to complete their electives in Israel if they're doing residency in Israel. And here too, our students complete electives within Beersheba and also around the country. They complete them often in top-notch institutions. Our fast-growing alumni network in Israel are often eager to assist our students find these placements. As the school has matured and we've had more and more alumni graduating, this has really become exceptionally helpful for all the students that are entering now, or opening up many more opportunities for electives and clerkships. The electives run from July through December of your fourth year. From mid-January to mid-March, students embark on their 8-week global health clerkship. These clerkships give students the opportunity to have hands-on experience using all they have learned as students prior to moving on to residency. Clerkships are at pre-approved sites that are reviewed annually for both their safety and academic standards. We have exchange programs with a few select sites, such as Ethiopia, where they too will send students to MSIH for clerkships. Historically, as I've said, you can see here some of the countries where our students have completed their clerkships. During the pandemic, we've had to quickly pivot to a different clerkship module. As I mentioned earlier, each site is approved not just for their academic standard, but for their safety. The MSIH team moved very quickly 2 years ago to bring back students from on their 7th week of the clerkship, when our antennas went up and we realized that something was brewing around the world. And thank goodness that we did. All students arrived back safely into either Israel or the US when the pandemic started. In the last 2 years, the school has not wanted in any way to diminish these clerkships, and they have opened up sites in Israel, and they have joined with sites primarily in Israel. There are 3 locations where students will get their global health clerkship. One site is in a Bedouin clinic in the middle of the Negev. Another one is up north in the Tzfat area. And these allows students to still have unique hands-on experience prior to graduation. Unfortunately, even in the most developed countries in the world, there are still locations with very, very severely underserved populations that are allowing our clerkships to continue. How these clerkships will go in the future, I think if I had a crystal ball, I'd be very big in demand right now. We are hopeful to return to all these sites, but we will do so as we continue to monitor the safety of all our students.
Thanks, Beth. So that's really a snapshot of 4 years at MSIH. So what do students do after they graduate? MSIH really offers a path to residency that's parallel to that of top medical schools in the US. Last year's residency match rate was 93%. On average, it's about 95%. So the students do very well matching for residency back in North America, particularly the United States. There is the option for students who want to stay in Israel that they can complete stage and then go on to complete residency in Israel. Students, no matter where they're planning on doing residency, so whether that's in North America or Israel, receive extensive advising to help guide them along the path. And you can just see a list of some of the places students who got residency last year in the US. But as I said, there's students every year who choose to stay in Israel and complete residency there as well, and that is fine. And here's just a little bit more comprehensive of a list of where students have completed residency over the past 3 years. The 2 things that I want to point out here, first of all, the area of specialty. A lot of our students tend to be drawn to primary care related fields, and I use that term very loosely to encompass family medicine, internal medicine, emergency medicine, pediatrics, general surgery. But there's also students who really choose to specialize in anesthesiology, as you can see, in neurological surgery, ophthalmology, radiology, a whole host of different specialties. So that again is just over the last 3 years. And once again, a list of the residency institutions, or some of them that our students have done residency at in the US. There's also schools or residency programs in Israel where our students are doing residency as well over the past 3 years. And now I just want to highlight 2 alumni who are back in North America doing did residency here and are working here in the States. Sarah is a graduate of MSIH in 2016. While she was with us, she did her clerkship in the Philippines. Most students will tell you if you talk to, or most graduates will tell you when you talk to them when they graduated and where they did their clerkship, since it's such an integral part of the program. But also you can see she did her residency in psychiatry at Georgetown University Hospital in DC, and she's still in DC doing her fellowship at George Washington University. Dr. Skera is one of our Canadian students. So he did his undergraduate degree at the University of Toronto, came to MSIH, did his residency in the US. Our Canadian students tend to do their residencies in either the US or in Canada, unless they choose to stay in Israel. But the Canadian students really have the option to apply for residency in the US and Canada, which is nice. He practiced after he did his residency in the US. He went back to Canada and practiced in Ontario up at the University of Western Ontario School of Medicine up there for quite some time. And now he's back in the States doing psychiatry in Hartford.
Dr. Jonah Cohen joined MSIH after earning his bachelor's degree at Brandeis University in 2013. And he graduated MSIH in 2019. While at MSIH, he completed his global health clerkship in Nepal. Jonah then went on and joined Electives Hospital in Tel Aviv, where he completed stage and is currently an anesthesiologist resident at Electives. While a second-year student at MSIH, Jonah was exposed through his studies to the Ethiopian community, and examined the implications of various interventions on the health and well-being of this immigrant population. In 2017, Jonah published an article in BMJ Case Reports focusing on the Ethiopian Jewish community from a global health perspective. So you will see our students are very active in research, both while at MSIH and even after they graduate. Just as we mentioned earlier, some of the places you can find our alumni in the States, I want to share with you some of the top institutions where our alumni can be found in Israel. Here too, the program allows various options for our students. They may prefer to go to large world-renowned hospitals, such as Soroka University Medical Center, or Shari Tzedek, or Hadassah Ein Keren. But our students, some prefer to go on the more local level for healthcare, whether it's a City MD in New York City, or whether it's a Clalit in Beersheba. Some of our students even are in the public health field, such as Dr. Eric Haas, who is now the Director of Routine Immunizations in Israel at the Ministry of Health. Dr. Haas recently shared with me that he has counterparts at the CDC in Europe who are also MSIH graduates. Now I'd like to share a little bit about the university and about Beersheba. Ben-Gurion University is consistently voted the #1 university in Israel from student experience amongst all the universities in the country. Our beautiful campus, which is an enclosed campus, is located in the center of Beersheba, which is Israel's fastest growing city. There is a train station right on our campus that will link you to Tel Aviv in 1 hour. The train system is very user-friendly, and it's used and it's bringing growth down to the Negev, which is now being developed both for the public and the private sector. Our students and our faculty are extensively integrated to all aspects of the city, including community outreach, volunteer work, and social life. While Beersheba is Israel's 4th largest city, it is #1 in growth, with everybody moving south. The train station that stops on our campus is connecting both our university with a technology park that is located right across the street. This technology park is a hub for technological research, biotechnological research, cybersecurity, and bioresearch, where often companies are turning to BGU staff and students to assist in their research. Recently, we learned that many of these companies that are doing bioresearch are specifically turning to MSIH students to assist them in translating their research project. This is opening up once-in-a-lifetime opportunities for our students. We encourage our students to take part in all the various opportunities and clubs that are on activities that are on the campus. And they vary from whatever your interest is, whether it is student government, or it is AMSA, or Hillel, or global health. There is a club for you. Enrich yourself in the culture of the university, of the greater university, and of Israel. We are part of a close-knit community that is often referred to as the MSIH family. We provide host families for those who wish to connect to the local community. And there you go.
Thanks, Beth. I'm just going to talk a little bit now. We've talked about MSIH, what our students do while they're with us, what they do after they graduate. So now I want to just get a little bit more, take a step back to the admissions process at MSIH. We get a lot of questions surrounding admissions and what we're looking for in terms of students. And I want to first say there is no typical MSIH student. Our students are very diverse in terms of their backgrounds, in terms of their path that led them to MSIH, but there are certain things we look for when we're looking at an applicant. First of all, we're looking for a strong academic record. And that's important because medical school is challenging and we want our students to be able to succeed. So we look at some of the metrics, such as your MCAT score and your GPA. These are just averages. We don't have cutoff MCAT scores or GPAs, but by looking at the average of accepted students, you can really get a sense of the competitiveness of your application. So the average MCAT is a 509 and the average GPA is a 3.6. With that said, we don't just look at the numbers. We're going to delve deeper into your academic record. We're going to look at grade trends. Perhaps you, as an 18-year-old in college, you struggled a little bit academically. And then there was a grade trend where you really increased. And by the end, you had a very strong GPA. Perhaps there was a semester where you had a personal challenge and that brought your average GPA down, but the rest of your semesters you did really well. Or perhaps you did a post-bac, so your undergraduate degree undergraduate GPA might not have been as strong, but your post-bac GPA is strong. So we're not just looking at the numbers. We're going to look at how you did in your science classes. What science classes did you take? What other coursework did you take? We're going to look at your MCAT score, but we're not going to just look at your MCAT score as a total. We're going to look down to the different sections. For instance, you may have struggled a little bit in chemistry in college, but your MCAT score in the chemistry section, you performed very well. So we're going to really look at everything in the context of your complete application. Also, in terms of academics, we're going to look at your letters of recommendation. We require 3 letters of recommendation, 2 of which should be academic in nature, so someone who knows you as a student. So that's really what we're looking for in terms of your entire academic portfolio. It's not just looking at the average the MCAT score and the GPA, it's looking at everything in the context of your entire application. Now at MSIH, about 1/3 of our students are not science majors, and that's completely fine. That really diversifies our class in a different way, and it's important. So you can be an anthropology major, a sociology major, a religion major, an economics major, and still apply to MSIH, or you can be a more traditional undergrad pre-med student who majors in biology or biochemistry or neuroscience or something like that. As long as you've taken the required prerequisite coursework, that's fine. We require 2 semesters of biology, 2 semesters of general or inorganic chemistry with labs, 2 semesters of organic chemistry or biochemistry with labs, and then either 2 semesters of physics or 1 semester of physics and 1 semester of math, like calculus or statistics or something like that. We look for students who are committed to volunteer work. Our students work a lot with underserved populations, and we want to make sure that's something you're passionate about and comfortable doing. It doesn't have to be medical volunteer work. You don't have to have all your experience in the medical field. You could volunteer as a tutor. You can volunteer in all different ways on campus, but just somebody who's committed to volunteer work. We look for an interest in global health or public health, and I use that term very lightly because that can take on a whole host of different shapes and sizes. So you could be somebody who majored in global health or public health or minored in it. You could be somebody who took an economics class and learned about how economic disparities really manifest themselves in healthcare. You could have done a medical mission trip. You could have worked as a local EMT and really encountered a diverse patient population or worked with an underserved population, and that's your interest in global or public health. So it doesn't have to be something specific that we're looking for, just an overall interest in global health and public health. The other thing that I don't have up here, because it's not required for our program, but many of our students have it, is some research experience. Again, it's not required that you come in with research experience to MSIH. You will do some research while you're with us as a student, but you don't have to have that background. But many of our students have had some research experience, and they highlight that on their CV or in their essays or different things like that. The other thing is our students, as I said, are diverse. They're diverse in terms of their backgrounds. They're diverse in terms of where they come from. We're a medical school focused on international health and global health. So it's important to us that we have a diverse student body that comes from all over the world. The vast majority of our students do come from North America, either the US or Canada, but we have students who come from other countries as well, from South Africa, from the UK, from Ghana, from Germany, from China. And that really helps us, I think, helps the students learn from one another while they're at MSIH. Some of those students come directly from their home country to MSIH, having completed their undergraduate degree in their home country. Others have come to their undergraduate degree in the US and then come to MSIH. So here's just some more information that I think will really help you learn more about our program. Remember, medical school is about a fit. Yes, in terms of admissions, we're looking to see if we think you're a good fit for MSIH, but you also need to ask yourself that same question. Is MSIH a good fit for you and for your career goals and everything like that? What you want to do in medicine, the type of medicine you want to practice, where you want to study medicine, what kind of experience you want to have in medical school. So I really encourage you to visit our website. You can just type in MSIH in any Google search and it will come up, or you can write that down. Also, if you have any questions, there's our admissions email. I will also follow up with all of you after this with a recorded copy of this webinar. And then you'll have my email as well. So you can ask me any questions, or Beth. We really take pride, Beth and I, in answering students' questions as promptly as possible. Usually within 24 to 48 hours, we get back to students. We know what it's like to be applying to medical school. We know the stress that some of you are under in that process, and we try to make the process with as low a stress as possible. I'm not going to say stress-free because I don't think it's ever a stress-free process. We try to minimize the stress as best we can, and we really get back to students and try to guide you and answer your questions that you may have. And last but not least, I really encourage you to go read our first year student blogs. Again, you can just type in MSIH first year blogs and they will come up. Our students are great. They blog about so many different things, from classwork to clinical work, to their travels, to adjusting to life in Israel, to their classmates, everything. And it's really, I think, a good way, like I said, for you to see if MSIH is the right fit for you. So thank you again. I'm going to stop sharing my screen and we're going to open up the floor for some questions.